All right, good afternoon, everyone, and welcome back. And for those of you who are joining us for the first time, welcome to We See You. And for those of you who are wondering what that S.E.A. stands for, it stands for Support, Educate, and Advocate. And today's We See You is all about World AIDS Day. So today we're just going to have a really informal conversation about World AIDS Day and some of the things that we have learned as a EHE team about HIV and AIDS for the last year or so. So we are going to jump right into it.
I'm going to begin by giving you all a little bit of history about World AIDS Day. It began in 1987. James Bunn and Thomas Netter, who were public health information officers for global programming on AIDS, came up with this idea. They took it to their boss, Jonathan Mann, the director of the organization. He loved the idea. And boom, December 1st, 1988, there was the first World AIDS Day. And the purpose of this is to bring about awareness and just to help build new policy and programming around HIV and to help to end the epidemic, which we've learned over this year that we're still in.
Yes.
And so I was a little taken aback when I first learned that we were still in the HIV epidemic when I first started doing this work, because it seems like after 40 years, we wouldn't be in that place. And so one of the other things that I've learned over the past year is that there's still a lot of stigma behind HIV and AIDS, and it's not talked about, particularly in the Black community, particularly among Black females, because we are still the highest population that contracts HIV and the most affected by it. Not only as a illness, but even as usually the primary caregiver of the household in the Black community.
Right.
So either way, we're markedly affected by it more than anyone else. What do you all ladies think?
I could definitely agree with everything you just said. And even some of the individuals that we have talked to with lived experience, there is still like this underlining for a lot of them, and not for all of them, but for a lot of them, there's still like this underlining shame that comes along, and many of them have been living, or should I say, the disease has been living with them for a very long time, but there is still a certain degree of shame and, like you say, the stigma that goes along with it. And like you said, you would think that we have come a little bit further than that, or a lot further, seeing as though it is not a death sentence anymore. There is so much education around. So I guess the $1 million question for me is, what is it going to take for that stigma to go away or for it to be erased? Because there are populations that are, just like our agency and so many other agencies, we absolutely have the resources to support and educate and advocate for those that are living with HIV. But again, the stigma won't allow people to really reach out to those resources. And so for those of you who might be joining us today, we would love to hear your questions and your comments. We do have somebody working behind the scenes. Thank you always, Kanisha. So she is going to make sure that we receive your questions and your comments. We would love, love, love to hear from you.
I think a lot of the stigma also comes from us not wanting to have just conversations. I think HIV was something that it was always kind of like kept hush hush, like if someone was diagnosed with it. So I think a lot of people still tend to look at it that way, so they don't talk about it.
Right.
Like you said, because fear of shame.
Or it was covered up to be another type, it was like a cancer, or it was always something else other than what it was. So instead of people educating themselves, they would rather pretend like it wasn't happening, or that's not what that person was living with. So just having again, Ashley, having those conversations, but why are these conversations still so taboo?
And I think it would be helpful if we were able to have these conversations in the schools, because the younger kids start learning about it, the better there's a greater understanding, and they will grow up without the taboo of HIV and what it means or what they think it stands for, because it's now like any other chronic illness,
Right.
diabetes, high blood pressure. You take a pill and you treat it every day. And there are people walking among us that are living with HIV, and we don't know. So,
And they don't know.
and they don't know. 1 in 7.
Yeah.
Yes.
Right.
1 in
Which-
7.
yeah.
So we need to start encouraging our governments and powers that be to advocate for students learning about HIV, healthy relationships, healthy sexuality in school, so that we can decrease this number at an early age. Because other than Black women, the younger kids are the other greatest population other than the MSM. So you have younger kids, the 13 to 24 age group, you have Black women, and then you have MSMs. And so, yeah, and one area that we can encourage people to get tested at an earlier age is in the schools with the younger kids, and younger populations, and encourage them to have those conversations among themselves and their friends.
Right.
And I honestly think this generation would be more open to having the conversations, because they tend to talk more than, I guess, the elderly or older individuals.
Yeah, yeah. It's typically not the youth that have the issues talking about these things. It's the adults around them that are uncomfortable.
Mhm.
And I'm glad you said something about the school, Chanel, because starting in 2023, we will actually be in the schools. So
Yes.
shout out to Excel Charter School.
Yes.
Because we are going to debut this program at the school, and they're just very open to what we are trying to present to the community. We got to start earlier than what we're starting.
Yes.
So if we can start with these young people and have conversations, and hopefully they will be open to us doing some testing on campus as well. So hopefully, the passion that they have for learning, maybe other people will catch on to that. Oh, hey, they might be setting the example for some adults. Who knows?
Yes, exactly. And along with the lack of education, you have other barriers that people living with HIV, or even just people in general, face to care.
Mm-hmm.
And a lot of times those barriers are what's hindering them from either getting in care, staying in care, sometimes getting tested, or just even having those conversations about condom use with their partners. And because you may have some intimate partner violence, you may be unhoused.
Right.
You
And
may
that's
have
huge.
not an employment situation. You may not be employed.
Right.
And I
And
think too, like location plays a factor too. I mean, like,
yes,
I grew up in a rural community. Everybody knew each other.
Right.
So like,
know your
a lot of
business.
right, tend not to go to different like medical facilities because they're afraid of running into people that they know.
Right.
And then that person telling other people in the community.
Yeah, that really rubs me the wrong way.
Mhm.
Mind your business. And the things that you need to tell, we don't tell.
right, exactly.
The news that we need to share, we don't share.
Right.
But we definitely gonna run and tell somebody's business. And you know, if that person is trying to better themselves, trying to take care of themselves, don't go run and tell that. That's absolutely awful. And I don't know about people, but that continues to happen, especially in rural communities. And then especially if you're talking about a young person that is trying to educate themselves or take care of themselves, you know, their mama's gonna be told, auntie, grandparents, and it's really detrimental to what we are trying to do. It's counterproductive to what we are trying to accomplish.
Yes. And also, healthcare professionals, they, primary care physicians aren't
Right,
as much involved as they should be with care of those living with HIV or with testing or offering OBGYNs. It's one of those things where you have to ask for unless you're pregnant. And so, it should be the norm. That should come in the full workup that you do once a year when you go to your primary care physician and you go to your OBGYN for ladies, for your annual checkup, is an HIV test, an STI test. And then I think that also encourages the lack of stigma when you go into your doctor's office and they're talking about it. That makes it kind of normal because
right,
they ask you about your blood pressure, they ask you about your your diabetes, they test and check for all of those things without really giving it a second thought. They're like, when was the last time you had a blood panel? What's your blood pressure running? Those are all the questions that they ask, but they don't ask the question about HIV, STIs, what your sex life is like, or any of those things, which that should be encouraged to start happening.
right. And it would make it less uncomfortable.
Right.
Because doing testing out in the community, there are certain questions that get pretty deep off into your business, like your sexual partners, whom you might be having sex with, how often, and that can be very uncomfortable. But if we continue to have conversations like this, people will be less ashamed because we're not here to judge. So people, doing this work, we're not here to judge. We want people to be educated and to live your life, but take care of yourself at the same time.
Right.
But it is definitely still very uncomfortable for a lot of people. But I think it's going to be less uncomfortable for the young people. And we got a comment from Ginger. So we thank Ginger for joining us today and always supporting us. She thinks that it's amazing that we're going to be in the schools. And, hopefully the young people will take that information back to their households, to their, whoever their caregivers are. If it's their biological parents or aunts and uncles, grandparents, whoever they may be. Who would you say, Ashley?
Grandparents.
Yeah. So maybe they'll take, and that's a whole different generation. So I would love to hear like the conversations they would have with those generations about sexual health and HIV and all of those things. I mean, because families should be able to talk about these things.
Right.
Family should be the foundation of this work.
Right. And I know there are a lot of conversations and things that my parents will listen to my kids about before they listen, to me.
Right.
And I think they're kind of the key to the expansion of this information.
Right.
And they have a way of informing their grandparents and even their parents that make them listen, that we may not have the same impact.
Right.
And so it's really exciting to be in the schools so that they can learn that information, not only for themselves, but like you said, to pass it along to their parents and their grandparents.
Right.
And I think that's something that's good about this generation. Like they take the information and they run with it versus like some older people, they feel like once they get the information, they don't feel the need to like share it with other
Mhm,
people.
mhm.
So I do feel like the younger population would take the information and run with it.
Mhm. They share it on social media, they share it on TikTok, they share it everywhere
Right,
because
right,
they don't see any harm in it.
right.
And so,
And we'll also be learning from them though. But
right.
we learn so much from them. I mean, whether it's lingo or or whatever it may be, I think all of that could be tied into education and awareness about HIV.
Because the thing that I have learned having teenage boys is they know a lot more than we think they know, or
Oh,
even we think they
absolutely.
should know. And so
Right.
if you listen to their friends, if you listen to their conversations, they already know. So it's not like we should be afraid to teach them. I feel like it's better for them to learn the correct information from me than it is to
Right.
learn from their friends or hear it from their friends, which it may or may not be correct. So.
Right. And so the more youth we educate, if they get the correct information, at least when they do pass along the information, it will be correct. They won't continue to be misinformed because it's everywhere. Like you said earlier, there are so many people that are positive and don't know it, and they're walking amongst us every day.
Yes.
And if they don't know, their partners don't know, and so then we continue to have people that become infected, and that's the whole goal, to stop new infection.
Yes.
And to get people in care that are not in care.
Right. And people are still misinformed that they think that they can get it by touching utensils or
Right.
by hugging or kissing. And, people are still misinformed. And in 2022 think that you're able to get it that way, but
Right.
it's not.
Right.
You can only get it from vaginal secretion, semen, blood,
Mhm.
not saliva, not tears, by touching utensils, none of that. So that's why it's so important that we educate people, because when people are vulnerable and sick and need advocates and love, we have to be informed so that we can give them what they need, and not be fearful that we can get something and therefore not making them feel like someone is there to support them.
Right. I think something else that I have learned over this past year as well is, if you're talking to someone about their HIV, status, like knowing their status, how important that is. If a person is hungry,
Yes.
or if they are homeless, if they're having some type of issues with their children, or they are a victim of sexual assault or domestic violence, if they're dealing with that, typically HIV, knowing your status, is not going to be at the top of the list. So, if we can, and at Lifelines, we believe in wraparound services, the holistic approach. So what we have noticed is, if we can assist with all of these other needs, then we can stress the importance of knowing their status.
Because nobody's trying to go to get meds when they can't even go and get something to eat.
Right, that's right.
So
yeah. So, and I think that's important for people to keep in mind. Like, we have to deal with the entire person, not just the HIV, or not just, whatever they're dealing with. We want to deal with the entire person. And that's what's so great about Lifelines, and Lifelines being involved in this work, is that we do have the resources to service the entire person or the entire family. Because, if that person's family is not good, then they're not going to be okay. If your children are not good, that mama, that daddy's not going to be okay.
Yep.
So I believe we have another comment from Facebook. Mika Dale, I'm on board with you. Thank you, Tamika.
Also, mental health is very important, because mentally to get a diagnosis like that, you have to wrap your mind around that in and of itself.
Right.
So we also have to remove the stigma of therapy and mental health and getting help for our mind. Then once we get our mind right, the rest
Right.
usually follows.
Right. Right.
And we can think
Yeah.
about doing the other. But
Right.
if you come in prior to a diagnosis with your mind not right, then you aren't ready to receive or listen to the diagnosis in
And you
order to
really
get help.
can't.
Right.
Yeah.
So we have to be open and willing to ask for help, seek help. And that's one of the great things about Lifelines. We have a great, great, great staff of therapists
Shout out to the therapists.
that are here to help.
Right.
And and we refer and they refer. So but it's very important to get therapy and to help your mind get right so that you can seek help for your physical well-being.
Right, right. Yes, absolutely. And I think if that person is struggling with some type of substance,
Right.
Which of course is another way that a person can become infected with HIV is through needle usage. So, if you are struggling with substance use, that's something else that, that person is definitely going to have to. And then why are you dealing with a substance use issue? Like what came before that?
Right.
There's always something that came before that. So I think, dealing with those things, I think is just going to be very important when dealing with someone who is newly diagnosed or out of care.
Right.
That is positive.
And people are also misinformed about about insurance and about the availability of meds and testing and there are tons of places that you can go and get tested for free.
Yes.
There are plenty of places that you can get meds for free if you're in and out of care, in or out of care.
Right, right.
You don't have to do anything with your insurance. So there are resources out there. And that's why it's so important for people to know about places like Lifelines and to have advocates so that what they don't know, someone can tell them, or someone that does know can help them to figure out.
Right, absolutely. And I think it's, just as important, to have our awesome community partners that we have. So definitely shout out to the Mobile County Health Department, AIDS Alabama South, Franklin, Shell Health. Yes, ma'am, absolutely. So, we need each other. And I think it's also important that, for the people that are doing this work, as we do this work and we're supporting people that that are living with this chronic illness, that we support each other. Because this can be real heavy.
Right.
So I think that it's important as community partners and stakeholders that we support one another and be invested, in what the other person or other teams or other agencies have going on as well.
And it's also important that we share with other agencies, especially those substance abuse agencies, those transitional housing agencies, and all of those agencies and facilities, that we have this, we have the EHE team and we have these connections with the other facilities like Shell Health, so that if someone living in their house, if someone living in their housing comes to them and says, okay, I think I may, or I was exposed or whatever, they know the services that we offer so that they can pass those along to those living in the facilities.
Right. I think it's also important too for speaking of like housing and facilities, I think it's very important that people that are positive know their rights.
Yes.
We have agencies like the Center for Fair Housing here locally in Mobile. If you know your rights, like you said earlier, know your resources, because that, that person being misplaced, being homeless, not receiving the services that they need. Not okay, should not be happening.
Right.
And if you feel like maybe you need someone to advocate for you, reach out to those advocates as well.
Right.
Because I think that is going to be really, really important. Like there are just so many people that don't know what their rights are. And so there are things that are happening that should not be happening to them. All right, so our listeners today, we would love to hear from you. If you have any comments or questions, our beautiful technical person behind the scenes, Kanisha, is going to make sure all of those questions and comments will be in our chat. So we'll probably be on for another couple of minutes or so, but we would love to hear from you. So what do y'all think the next step should be, ladies? I think Chanel, you were about to say something.
Well, I think the next step, I think we were kind of along the same lines, is informing those city officials and those who are in policy to help us to get the word out and up and change some policies around housing and those things that are barriers. Because once those barriers are corrected, then all of the other stuff will kind of, I think, fall into line and people can wrap their mind around their diagnosis and, getting tested. And if they're in a domestic violence situation, they may be afraid to ask their partner about condom use or to get tested. So before you've got to get all of those other things corrected that are barriers. And I think if we have different policies and programs set in place on the local or regional or state level that can help with that, I think all of the other will come into place as far as the testing and bringing down that number of those living with HIV.
We got a, Chanel, if you want to answer, we have a question in the chat. It says, where can people get tested?
They can get tested at Bell Health, as well as Franklin and Mobile County Health Department. And we will soon be testing out in the community.
Yes, we will.
As well here at Lifelines.
I think that's going to be very beneficial to the community with us testing at Lifelines, just because I feel like it's going to erase that fear of people running into people that they may know. So I'm really excited about testing at Lifelines.
Absolutely, absolutely. And also being able to offer PEP
Yes.
to our sexual assault survivors. And for those of you who may not know what PEP is post-exposure prophylaxis. And it's for, when you are assaulted, you don't know whom you've come into contact with, and you might actually know the perpetrator. But there are certain aspects of that you may not know. You may not know that person is positive. So we just don't know. We don't want to take the chance. So PEP will be offered to our sexual assault survivors in the hospital setting, at USA Children and Women's, at our community setting here at our office, and at the freestanding clinic. So we are very excited that we will be able to offer that service in addition to other services.
And also, and it's also very important in the other area that we don't really think about or even talk about is trafficking and sex work. It will provide a place for maybe those who aren't comfortable going to those other facilities, because
Right.
it is kind of off the beaten path, that are unfortunately in sex work or that may be passed through for trafficking, that can get tested and get PEP and possibly PrEP and can be able to take care of themselves. And for those of you all who don't know, PrEP is pre-exposure prophylaxis.
Pre and the post. We take care of you before and after.
Yes. And
That's
PrEP
what
is
it's
just
all
one
about.
pill a day.
Right. Right. So I just think it's important for us to keep saying it.
Yeah.
For us to keep saying it. So, you know, if it does not catch that person's attention, maybe the first time that they heard it, maybe it'll catch their attention the next time.
Yeah.
And, you know, for, you know, any elected officials that might be watching or may watch this later, school board, any superintendents, teachers, health teachers. If you have any questions about any of our services, please, please, please contact us. And we will make sure that we give that contact information before signing off. But we want to hear from you. You know, everybody should be a part of this work because it affects everybody at some point in your life.
And we don't want it to have to affect us directly in order for it to be corrected.
Right, absolutely. Got a comment from Miss Shamiko Barron. Hey, Miss Barron, thank you for joining us today. So hopefully we'll get a chance to work with Miss Barron soon and her group of young ladies as well. So and that's what it's all about. It's all about just supporting one another in partnership. I think is really, really important. All right, so do we have anything else that you ladies would like to cover today? Any last words or final thoughts for this go around? No.
This is everyone's, just like with COVID, it's everyone's responsibility to not only protect themselves, but to protect their partner and their children. And the best way to do that is through education.
Right.
And not being afraid to have those uncomfortable conversations, especially during the holiday time. We've got Christmas coming up, we've got New Year's, we've got Mardi Gras. So all of these opportunities that we were with our family and with our friends, it's a good time it's a good a time as any to bring up those conversations because we want to be able to see them around the next time. So
Right.
please continue, please continue to have these conversations and bring about awareness to your family, your friends, and your community.
Yeah. And you know, so many lives have been lost since the first cases in 1981. Let's not continue to lose people.
Not when we don't have to.
Right, that we don't have to. So let's keep spreading the love and awareness and education so we don't continue to allow people just to fall, you know, through the cracks.
Yes.
Leave the judgment out. Remember to just treat the whole human. Everybody is human and treat them as such. Well, all right. Great conversation, ladies. And thank you to those who joined us today. Maybe it was your first time. We thank you for joining us. And if you have been with us before, we thank you for coming back. If you would like to know more about Lifelines or know more about EHE ending the HIV epidemic, please do not hesitate to give us a call at 251-431-5100. You can ask for Kelsey, Ashley, or Chanel. We are always willing and ready to speak with you about any of our services. If you are a victim or survivor of sexual assault, you do have access to 24/7 advocacy. So that number is 251-473-7273. Please, whatever you're dealing with, please do not continue to suffer in silence. Know that we support you. We are definitely here for education and we are definitely advocating for you. So until next time, everybody take good care.
Bye.
Bye-bye.